Good
Good
evening,
evening.
and I'm sorry.
Go
Welcome to
ahead.
Conversations with a Commissioner. Tonight, our special guest is Commissioner Nancy Jackson of District 4, who is the Arapahoe County Board Chair for 2021. She will be on hand tonight to give you a little update on county news and then take some questions from the callers and those who are dialing in online. These are the quarterly events that we normally would do in person. These are town halls that we'd like to have each commissioner do in their respective districts. And we, of course, because of COVID, since last spring, we have not been able to do them in person. So we've worked with an outside vendor, Broadnet, to help us put them on virtually. And tonight is a night that maybe nobody would want to go out anyway, so it's probably good that we're doing it virtually right now in the warmth of our homes. We would like to do the next one in person if possible, and we will certainly keep you up to date on that. For those who are calling in and would like to ask a question of the commissioner, you're going to want to dial *3, and that will put you through to an operator who will help you get set up to get your question answered. And if you're joining us online on Facebook or on our website, you can just type your question into the comments box, and it will come up on the dashboard that we have here behind the scenes, and we will have the commissioner respond to those. So without further ado, let me introduce Commissioner Nancy Jackson.
Thanks, Luke, and sorry for the confusion.
My mistake.
They things happen. That's what happens when you don't have a rehearsal. So, welcome everybody, and we're so glad to see you. Actually, I can't see you, so I know that a lot of my friends and neighbors are on the call. So, welcome. And tonight, as Luke mentioned, we're going to talk. I'm going to talk about four basic topics, and then we'll have a little discussion, and then hopefully we'll have plenty of time for questions and answers. So our four topics, I thought I would let you know, are COVID, because that's the first thing practically anybody talks about these days. And then I'll talk about what some of our different departments are doing. I'll talk about our budget very briefly, and then two important topics, that is our open spaces department and transportation. So it's a lot to cover in a small amount of time, but we'll do our best. So without, as we say, further ado, let's talk a little bit about COVID. So next slide. The COVID slide, right? So you may have heard, and it's as confusing to us as it is to you. The levels keep changing, but the governor and the health departments are doing their best to keep up with the ever-changing scenario of COVID. So we're currently in level yellow, or number 2 on the dial, which means that our restaurants and our other businesses are opening up more. We're doing a good job of keeping our masks on and washing our hands and so on, keeping our distance, and so we have been allowed to move into dial number 2. And we have the 5-star certification program, which you may know about. It's a special program that restaurants and other businesses go through to make sure that they're following very strict protocols. And if you're interested, then you can go to arapahoegov.com/5-star and either find out whether your favorite restaurant is on that program, or if you are a small business, if you want to register for that program, you can go there as well. The other question that everybody's talking about is vaccines. And we know that it's confusing. Where do I go? When do I get it? And so on and so forth. I was actually on a call with Tri-County Health just before this meeting, and the we don't have control of how many vaccines we get. And Tri-County Health is doing their best to advocate to the state and to the federal government to allow us to have more. But as it is, we are doing a pretty good job of making sure that our number one folks are getting their vaccines. Our first responders, those of us who are 70 or older, are beginning to get more available shots. So we're hoping that in the next month or two, the 1B category will be done and we can move on to number 2. If you have questions, then you can go to tricountyhealth.org. But I also want to mention that there are a number of pop-ups, that is smaller organizations that are allowed to give vaccines. And so you can, again, go to Tri-County Health and find out where those might be. So the good news is that we are seeing a light at the end of the tunnel. The problem is it's a very long tunnel. So be patient and we will get there. So next slide, we'll talk a little bit more about COVID. So the next slide. Yes, thank you. So we the county, Arapahoe County, got $114.5 million from the Corona Aid Relief and Economic Security Act, which is the CARES Act that was passed last spring. And we shared about 45% of that with our 13 cities and towns. And we also rolled out a lot of different programs, some of which I'm going to talk to you about in a minute. But the criteria for how we spent that money is very, very restricted. And so we have done our best to spend that money. And believe it or not, our cities, our towns, and the county has managed to spend that money, not just on PPE or the personal protective care. We have at the county now lots of plexiglass screens and so on and so forth. But we have also supported testing, the vaccine distribution. I'm going to talk a little bit more about housing and food insecurity and rent and mortgage. So what we don't want to do is have more homeless people with COVID. What we don't want to do is to have folks being evicted from their house because they lost their job because of COVID. So we are also partnering with Stride, Lincoln Health, and a company called Mako that are providing testing sites. We are supporting contact tracing, and we have a lot of data that we are following to make sure that we can do the best we can for the needs of our residents. So our next slide talks about our community resources department. So this department it's got a broad responsibilities, including our Arapahoe Douglas Works, which is still doing training. They are also working with businesses. They have a business recovery roundtable that meets every week to talk about issues concerning businesses. AD Works, Arapahoe Douglas Works, does a lot of job fairs. They do skills. They do a lot of different kinds of training and helping connect employers with future employees. We also have, as is noted on this slide, we have a lot of programs for veterans and for seniors. We added a veteran services person in Aurora alongside our other 2 veteran services who work in our Lima Plaza offices. So we're also doing a lot of other kinds of things with our homemaker and housing programs as well. So lots going on in community resources. And I also want to say in general that community resources and all our departments, and we certainly felt it, how fast this COVID came on. And it seemed like one day everything was normal. And then the next we were all shut down. But in spite of that, our departments kept the ball rolling, kept providing the services that our citizens are used to. So we're really, really proud of how quickly our departments have responded to the changes in our lives these days. So next slide, please. I want to talk a little bit about our human services department. And this is the department that generally provides services, TANF, food stamps, our child protective services, adult protective services, and so on. And one of the things that we've used our CARES funding for was not just our hotel and motel vouchers for folks who have been experiencing homeless and maybe exposed to COVID, or who need temporary housing because they have COVID. We've also supported Meals on Wheels and the food banks. And we've also been supporting a lot of our behavioral health and physical health organizations for things like telehealth and PPE and so on. We also have what the Goals program is, which is, I don't know if you remember the formerly known Excelsior campus off of Chambers, but that's now the Goals program, which helps single women with children kind of get their act together, so to speak, provide supportive whatever they need, supportive housing, job placement, or training. And the 2Gen refers to 2 generations. So not only do the moms get some help, but the kids get help if they need it. We are working on getting a daycare center there, and it's a robust program to help formerly unhoused families get on their feet. And as we mentioned before, we've got lots of food and financial benefits and protective services for both children and adults. Our demand has really, really increased, as you can imagine, because of COVID. But nevertheless, we're doing our very best to make sure that everyone who needs food, everyone who needs some financial assistance, if they're eligible, that they can get the benefits that they deserve. So next slide, please. So we're going to turn to one of my favorite topics, the 2021 budget. As you might imagine, COVID has put a lot of stress on our already kind of strained budget. And so we are looking high and low, if you will, to be as careful as we can with your tax dollars. We call that fiscal restraint. So we are looking at every new hire. We are looking at every expenditure to make sure that we are doing what we can with the most cost-effective methods. Our property taxes, we're not sure what that's going to look like this year. Housing, it's interesting. Housing costs keep rising, which is sort of good news and bad news. It's good news if you're selling the house. It's bad news if you're trying to buy one. And the property tax is regulated by an assessment that is regulated by the state. So we're not sure what those numbers are going to look like going forward. However, in order to deal with all these changes and with our fiscal restraint, we've put together a new strategic plan, which you can see on the website. But we're trying to reprioritize things. We're trying to work smarter and harder, although we believe we already do work smart and hard. But we're going to have to really, as they say, put the pedal to the metal and work harder and stronger. So our strategic plan is going to help us with that. So we're evaluating all the county operations, everything we do. Most of what we do is mandated by the state or the federal government or is grant funded. But nevertheless, we continually refine and look for economy, better ways of doing things. And the last thing on this list is we we have facility and infrastructure issues. Roofs leak. I mean, wherever you live in your home, roofs leak, plumbing goes bad, carpeting wears out, all of that. And so we have aging infrastructure throughout our buildings. And so we're having to be very careful about, again, prioritizing and being really careful about how we spend that money. So we we do have financial challenges, and we are going to be asking for your input as we go through this moving forward, so that you can help us prioritize as to what you think we need to be doing. So I might add on this slide that we have a program called Align Arapahoe, which does a lot of process improvement, looking at just because we did it this way last year doesn't mean we're going to do it this way next year, if we can do it more effectively. And we're looking at the savings that the COVID crisis has brought to us. That is, so many of us now are working from home. Our printing costs have gone down, which is interesting. People are printing from home or not printing at all. And so we're really taking a very serious look at the savings that we can accrue from what we're learning through this crisis. Okay, next. So what I think of as a happier note is our open spaces department. Many of you in this pandemic time have been taking time off, I hope, to enjoy some of our trails, our parks, and some of the open spaces. Unfortunately, we didn't get to have an Arapahoe County fair, or is very, very limited. But we'll be doing that kind of fun thing again soon. So if you remember, our open spaces program is supported by it's the only sales tax we have, a quarter-cent sales tax that funds all these wonderful programs. And most of this, 62%, is shared back with the city. So many of you may live in Aurora, some of you may live in Centennial or other places, but share back that 62% with our cities, so that they can develop plans, trails, parks, and open spaces within the city as well, and use some of their own money and some of this open spaces money to really do some really wonderful, wonderful things. So we are creating now. Did I go away? I don't know if I went away, but I'm back. So we are finalizing our master plan, so that we can be very thoughtful and mindful of where we spend those monies. And that sunsets in 2023. And we are thinking about going out for a renewal of this open spaces tax, um, so that we can continue this program, maintain what we have, and continue to build trails, open spaces, and parks. So stay tuned for more. But in the meanwhile, this weekend's a little cold to get out on a trail. But if you're in for that, then go ahead. But when the weather's warmer, go out and take a walk on a High Line. We help sponsor a lot of those bridges across highways and so on. So go outside and enjoy our open spaces program. And then the last topic I have here is transportation. You would think that in a pandemic there would be less traffic. Telling you, I use 225 very frequently, even Chambers or Parker, all of our favorite routes to places are packed. And it's hard to manage with potholes and road repair, and we are responsible for all the roads in the eastern and unincorporated parts of Arapahoe County. And so quite frankly, as the first bullet says, transportation and mobility are hot topics, and that is for sure. And how to transportation entity is also a hot topic. So we are now collecting information from the citizens. You can go to this website, arapahoegov.com/transportation plan, and put in your say-so on what you think is important around the area that you live concerning traffic. We want to figure out also, the state has tried a couple times to get some funding for transportation. Those have gone down in flames. And so we need to hear from you how best to, what it is you want in transportation, and then how best to fund the transportation. Because asphalt, all the things that go into building roads and maintaining roads have all increased, and yet the value of our gas tax and so on has gone way down. Interestingly enough, especially with electric vehicles and hybrids and so on, the funding for from the gas tax is just not going as far as it used to. So we have this problem. We've got things we need to fix. We have roads we'd like to expand, bridges that need to be built or repaired. And so we need your help in helping us figure out what we need to do. So that's a lot of talking. And we are going to give you some time in a few minutes to ask questions. But for now, I think Luke is going to ask me a couple questions.
Yes, thank you, Commissioner. And for those of you who would like to reach out directly to the Commissioner, her email is njackson@arapahoegov.com. And for those of you on the line right now, and if you want to ask a question, if you're calling in, you should dial *3, and you'll be put through to an operator. And if you are viewing this on our webpage or on our Facebook page, you can put a question in the comments section, and we will try to answer that for you. One thing to remember is that we are not medical experts, so apart from the basic info about COVID and the dial and so forth, we don't have a lot of medical updates about COVID. But we do, of course, urge you to continue doing all the best practices, as the Commissioner mentioned earlier, the mask wearing, the social distancing, the avoiding large gatherings. We're definitely making progress, and we want to keep doing that. The state is recognizing our efforts and recognizing that our numbers are down. So it's definitely encouraging. Before we get to the audience questions, Commissioner, you're the chair this year. And you mentioned before the call that people had been asking you what's different about being the chair. So tell us a little bit about what that's like. This is now your third term, and your first term as chair.
Right. Thank you, Luke, and welcome to my home. So the 5 commissioners are elected separately from their districts, so we are equals. So I think that's really important to know, that the chair does not make any decisions that have not been agreed upon by all the commissioners. But what I do, or what a chair does, is sign documents that have been already agreed upon. Somebody's got to sign those. I chair the meeting. That is, I facilitate the meeting. You speak, your turn, so on. Trying to think what else I do. Sometimes I speak for the commissioners. So again, somebody has to be the spokesperson. We can't all speak at once. So there are occasions in which the chair will speak for the commissioners. But it won't be my opinion. It will be the agreed upon opinion of the whole board. So we pretty much try to make it, forgive the term, democratic, in that we vote on things, and we try to be really careful. When I speak my own opinion, I try to make it really clear that it's my opinion and not the opinion of the board. So it's something like that.
Handles most of our meetings. I can tell you that you're the one that we quote when we put a public statement out there. But as you mentioned, it's the agreed upon quote that the whole board is supporting.
Right.
So the other thing I want to get into a little bit is, this is your third term, and you've had a chance to really dig in a lot deeper on certain areas. One of which is the homeless situation in our county. The past year obviously has put homelessness a lot more front and center than usual. It's probably worse than it was a year or two ago in many ways. It's still very precarious. You talked a little bit in the slide presentation about the sort of efforts that we're doing. Can you talk a little bit about what we've done already, what sort of new things we're considering, and how we're looking at it differently in the wake of COVID?
Thank you, Luke. Yeah, homelessness is an issue that's near and dear to my heart, and I don't know, about a year, about maybe 2 years now, we convened a group of people from across the county to talk about homelessness, because homelessness, well, when a person who is unhoused is kicked out of where they are currently camping, let's say, they go somewhere else. Where are they going? They're just going down the road. And so it's not like there's a boundary. So we have to work across the county, and soon we'll probably be reaching out regionally, because folks without housing don't understand that across Colfax one way is Adams County, and across Colfax the other way is Arapahoe County. It's all one, and so we have to work together. We are working now with mental health organizations. We're working with Tri-County Health. We're working with cities across the county. We're working with experts in the field. So it's called Metro Denver Homeless Initiative, as well as the Colorado Coalition for the homeless. So we're working with a lot of different stakeholders in a group to talk about common issues, sharing resources, trying to figure out what are the best policies. The one thing that is critical to this is housing. We like to say the solution to homelessness is housing, but there's no way we can build enough housing. The county certainly can't. And so how do we maximize our resources? How do we help folks? Again, the prevention piece with eviction prevention, with all the supports that we have for food and for temporary assistance, for Medicaid assistance, and all the supports that we can bring, we think help. Our temporary motel vouchers help, especially on a night like this. People need to not be outside and freezing. So we're doing a piecemeal right now, but we're really, really trying hard to coordinate. And I believe very firmly that it's the county's responsibility to coordinate. The city of Aurora has a great homelessness program, and the Tri-Cities, which is on the other side of the county, Littleton, Sheridan, and Lakewood, Englewood, have a great program. But what we're trying to do is bring all those programs together and all that wisdom together so that we can share resources and policies. We're also going to start to look at land development and zoning codes. So what can we do in terms of our kind of rules around where can you build things and how you build them and so on and so forth. We're going to take a look at that as well to see if there's something we can do to loosen up some opportunities for affordable housing.
And you mentioned earlier in the slide presentation the need for the county to be more nimble and sort of on our toes as far as changing up our services and making them virtual and that kind of thing. One of the examples of this with regard to homelessness is because of COVID, they canceled the annual point in time survey, which usually happens in late January and happens around the whole state. And it's meant to get a head count, and as accurate as possible of a head count, but they couldn't do it this year because of the risks of COVID. So we are definitely working without a net, so to speak. But I think, like you say, it's really enhanced the cooperation between agencies and cities and counties and other entities that are trying to help this and looking for more sort of synergistic alignments between programs. That certainly came up with the CARES stuff, I think.
Yes.
So, and along those lines, we actually have a couple homeless related questions in the dashboard here. One of which is, do you know at this point what is happening with regard to homeless people experiencing homelessness and their access to COVID vaccines?
You know, if they're 70 or over, or they fall into one of those criteria, then they should be eligible for that. Now, do they have the resources to find a site or to get registered? Perhaps not. And so there will be some outreach teams, and Tri-County Health is working on that now, um, to to make sure that they know how to get signed up for those vaccines. As you know, the vaccines are free. It's just a matter of, and there's folks out in the Eastern Plain, and there's folks who have certain kinds of disabilities and so on that they don't have computers, or they don't have computer literacy. So we're working really hard with Tri-County Health to outreach to those folks and to make sure that they get signed up for the vaccine. Um, so yeah,
Excellent.
we're aware of that, and it is a tricky issue, but we're trying to do the reach out.
Excellent. Another question that I know is near and dear to your heart is the efforts that the county and our partners have taken to address behavioral health concerns. Can you talk a little bit more about the work you've done on that and what we're planning to do this year?
Um, I will say, this is Nancy speaking. Okay, so um, I will just say that Colorado has been woefully underfunded for years in terms of behavioral health, and so we are doing our best again to do to collaborate with one another and to follow best practices. I was the co-chair of the Colorado Safety Net subcommittee this year. I don't know if you know or have been following this, but last year Governor Polis put together a behavioral health task force to study this issue, and there were a couple of subcommittees, one on children, one on restoration to competency, which has to do with criminal justice, and then this one, which was safety net. What's our safety net? What really do we need to have in place? And we spent at least 6-7 months listening to stakeholders from across the state, providers, uh, consumers, people from all over, to find out where we lack and what we need to do. And so what the state has decided, so there's something like 97 or so different funding streams for behavioral health. And it's very confusing for the providers as well as the clients. So one of the things that the state is working on now is to put together what they're calling the Behavioral Health Administration, which will sort through all those threads and then put together a single source, a single, one entry location, so that people just need something, they go there, and then it's sorted out which particular funding stream is appropriate for that person. So that's one thing. I also sit on the board of Aurora Mental Health, and we are doing our very best to be as strategic as possible and to provide the services that are needed to the people in the community. Um, Again, because of COVID, we've been using a lot more telehealth, and for some people, for telemental health, for some people, they can talk to a counselor from the safety of their and comfort of their own home, and that seems to be working well. So we're expanding telehealth. And then analogous to that, or in company with that, is crisis services. Um, you never know, stuff happens, and there's a crisis. It might be yourself, it might be someone in your family, it might be something you see. And so we have a single crisis line now for the state, and we have crisis programs, walk-in programs, mobile crisis. The problem is it's not enough. And so we're working really hard to expand those services, and to find the funding so that we have adequate services for our residents. Um, in that vein, one of the really good programs that I know Aurora does, Centennial does. It's a program. Douglas County has it in their I think all through the county. It's called the co-responder program. And so it has happened more times than one would like to think that there's a mental health crisis in someone's home and somebody gets really agitated. There's no one to call, so they call 911. 911 sends out the police or the sheriff, which agitates the person even more. And the sheriff or the police have no recourse but to take them to jail, which is the worst place, in my opinion, for a person with a behavioral health problem. So what a co-responder program is, and there's a lot of different models for it, but essentially it is when they get that call, a behavioral health person goes with. Sometimes they go by themselves before the sheriff gets there. In other models, they go with the sheriff or the police department. At any rate, you've got a behavioral health, an expert in behavioral health who is encountering this person who's in crisis. If things become dangerous, the sheriff or the policeman will be backup, if you will. But this model has been proven to be really, really successful all over the country, and we can only hope that we can increase funding for that as we have places to take people who are agitated besides jail. They don't belong in jail. So we need to have these crisis centers so that they have an alternative place to go to calm down and to figure out what needs to happen next. That's a lot. That's not even all that's going on.
I'm sure it's not. It's probably just a portion of what we're doing. It brings up another COVID-related question that we've seen in the news a lot, which is parents and teachers' concerns about the mental health of school-age kids. You know, we're hearing a lot about anxiety, depression, that kind of thing. Do these programs address things for non-adults?
I think we're frozen.
Oh, I can hear you.
So yes. So
Okay.
BC, before COVID, we had behavioral connection is weird. So yes, we had people, we had behavioral health people in the schools. Now we have, as schools begin to open, some of those behavioral people will be there in person, but they are also available through, telehealth, through Zoom or that kind of mechanism. So yes, we're not abandoned. Oh gosh, we're not. We see working with young people is a really, really important feature of behavioral health continuum from very young kids to babies, not quite babies, but yeah, and babies and up until, older folks. So the whole continuum of ages needs behavioral health care at times. And so we do have people responding to schools. Is it enough? Maybe not, but we do have people there.
Yeah, it's certainly going to be a long-term program, effort to address all these things. But it's good to know that there are options for young people. Before I get to some more questions, I just want to remind everyone, if you're calling in and you want to ask a question to the commissioner, dial *3, and you'll be put through to an operator. And if you want to ask a question online, you can put it in the comments box on our page or on the Facebook page. And with that, one of the other areas that I know that you've focused closely on is criminal justice reform. We, of course, tried to pass a resolution, or I guess a tax measure that would have helped fund a new jail and detention center in 2019, and that was defeated. Since COVID started, there have been more efforts to reduce jail population for the COVID-related health issues that it might have caused. The jail still is in quite a bit of disrepair. and in need of upgrading in many ways. So can you talk a little bit about how we're thinking about that this year and what's on our agenda for addressing this?
Well, those are two different issues. One is the jail, and one is criminal
Fair.
justice reform. They are kind of related. Um, as far as the jail goes, we're doing a study now to see what our needs are going to be. The criminal justice reform that's been ongoing for the last couple of years has also affected both our budget and our capacity and what space we need. My hope for that detention center was to have space for mental health programming and some other kinds of diversion programs. But we'll put that aside. We still need those things. So the detention center is ongoing. We still have repairs. The ceilings and floors are still leaking. We still have terrible plumbing. The kitchen is inadequate. All of that is true still. We still need a booking and release center. None of that has changed. We are doing a study now to see how we can um, uh, keep our population down and do the repairs we need. But it's going to be difficult, quite frankly, because we do have budgetary challenges. So we're looking at that very, very carefully. As far as criminal justice reform goes, I chair a number of committees, and I won't go into all that now. And I'm on a state board, really, really looking at, because as I mentioned before, two things. One is housing, and one is and mental health. Housing, mental health, and criminal justice, they're like a cycle. If you leave jail and you have nowhere to go, you have no housing, the chances of you recidivating, you coming back to jail, are very, very high. If you leave jail and you have no treatment for your behavioral health situation, and you do something, or you fail to appear in court, or you do something silly or stupid or unmindful, um, then you end up in jail again, which is the worst place for you. So criminal justice reform has to take a look at how we deal with folks who have behavioral health conditions, people with minor offenses, look at sentencing, look at decriminalizing mental health, look at decriminalizing poverty, and making sure that that we aren't that there is no racial inequity, that we are treating everyone equally. So those are a few of my ideas about criminal justice reform, but it's all
Well,
linked together.
yeah, you really can see how they feed off each other. And in light of last summer's protests, which had a great deal to do with criminal justice, do you feel like there's more momentum behind making significant changes, regardless of what the funding situation is?
That was so heartbreaking, and it was on video, and we could
Right.
not ignore it. And so I think that people who weren't involved before, people who just it didn't pass on their radar for some reason, there was no way they could avoid seeing what happened and what happens. And it wasn't a unique situation. It just so happens that it was caught on video. So yes, I think more people are aware of the issue. I think that there is a momentum now, and I'm pretty sure that more reforms are coming this year, and maybe for the next couple of years, because we need to figure out uh, this justice system. Somebody once said it's neither just nor a system, and I think that's true.
Definitely. Shifting gears a little here, we have an online question. Someone is asking whether the commissioners, as a certain category of government employees, are you able to get the COVID vaccine before other members of the general public? How does that work?
No, no, I'm a over 70-year, so I we have COVID, we have Kaiser, and so I put my name into Kaiser, like many. I also put my name into UC Health, and I put my name into, I think it was Safeway or something. And so I was fortunate, and I did get my first shot. But no, we don't have any privileges in that regard.
That's fair. And you mentioned the multiple providers. That's one of the things we learned on the vaccine town hall we did last week is that even the medical people are saying, go ahead and sign up in multiple sites and from multiple providers. That's just fine. And that may be a little counterintuitive, but the idea is to get it out to as many people that are in the right group as possible, as quickly as possible. So that's definitely a good idea. Um,
I just want to
and
add one thing: is don't
yeah, go
make
ahead.
no. You can sign up, but if you make an appointment, you have to either cancel only one appointment, right? So you have to cancel the others, or um, or go. But what we don't want happening is people not canceling and then not showing up, and that's a dose that somebody else could have gotten. So that's really
Yes,
important.
very, very important. Good point. Yeah, we don't want to waste anything. And that's, I think, one of the reasons behind the governor expanding the groups a little bit too, is to make sure nothing goes to waste. Um, on another topic, a lot of people are always look forward every July to the Arapahoe County Fair. We are currently in the planning stages for that, as we would be at any February of any year. But obviously, with COVID, there's still a lot up in the air. What can you tell us so far about how the county is approaching the fair for this summer?
We are approaching it hopefully. How's that? We we don't know. We don't know any more than anybody on this call knows about what's going to happen in July. So we're doing our best to tentatively plan a smaller, safer fair. We're working with some vendors who uh, have maybe a more flexible kind of contract. Um, so we're planning, but we're planning it with our eyes open. So you all will be the first to know when we can actually say, yippee, we're going to have a fair. Because it's fun. It's really fun.
Right. Yeah, and they're doing a lot of innovative thinking around it about ways to get people in and out safely, and scheduling attendance and things like that. So we hopefully will have news about that in the next few weeks. We have time for more questions here. You mentioned earlier the 5-star program for certified businesses. Um, can you talk a little bit more about why would a business want to be a 5-star business?
That's kind of a loaded question because now that we are in yellow, it doesn't, there's no need to sign up right
Right.
now because until I think 70% of 70-year-olds are vaccinated, um, we're not going to be moving to the next. I think it's green is next. So if we go back to orange, then the 5-star programs with all those the inspections and the criteria and so on could move to yellow, and they could have more people in their dining rooms. Nevertheless, I think as a consumer, you would look at that list and say, you know what, I feel really safer that this restaurant has been inspected and has been certified as safe. So I think there's still some reason to do it, but it's not the same bonus that you would get when we first started the program.
Right. Yeah, the difference between, for example, for a restaurant, the difference between orange and yellow is the difference between 25% capacity and 50. The gains are a little less significant as you go down the list. The one thing that getting certified I think would help businesses with is if we do move one way or the other, like the commissioner just said on the dial, you can immediately qualify to go to the more forgiving level. And so that's something, we're still encouraging companies to do if they want to. It's certainly peace of mind for their customers and that kind of thing. We have time for one or two more questions. I'm going to go to an online question now. And this gentleman is saying that his truck was stolen at the beginning of December. And the Arapahoe County Sheriff's deputy that was assigned to the case, that he went from around 150 cases to more than 1,000 during the pandemic. Do you think they are understaffed? I know that we have seen a lot of sort of public service announcements about lock your car, keep your valuables out of it, and that kind of thing. What is the board hearing about things like car thefts?
Wow, I have not heard that. So I'm surprised.
That was
A
new to me
thousand?
too.
Really?
Yeah.
So I'm gonna make a note of that and ask the sheriff what that's about because I have not heard that. I have heard in general that car thefts have been up. That I've heard. But but I didn't know that. And no, we have not been asked by the sheriff for more appeal. So more patrol. So I haven't heard that, and I will ask.
Yeah, we'll bring that up in a couple different forums just to make sure that everybody's getting the attention they need for that, because it's definitely been an issue, burglaries, car break-ins, things like that. So, all right. So as we get near to wrapping up here, as I mentioned earlier, you're in your third term as a county commissioner. Um, talk about a little bit about how the county has changed since you first started as a commissioner.
Hmm, it's interesting. Um, when we first started, or when I first started, the budget situation, because of the economy, was not as dire as it is now. Um, and so we were not, even though we had started our performance management program, it just didn't look like we were going to have to start cutting things or having to deal with service levels. So one of the big issues is our budget situation. And so that's one difference. Uh, what I'm trying to think, our performance management system is well in place, whereas it was just beginning, and people didn't know what it was when we started. Now they're seeing that um, setting goals and measuring goals is really of benefit to everybody, and so that's a big change. Um, I started a couple committees. So I started the homelessness committee. I started the behavioral health committee of our justice coordinating committee. So those two things are new. Trying to think if there's any new human services programs. I think the need has grown in our human services department, in our community resources department. Um, that has grown. Our AD Works or Workforce Development Center has really taken uh, working with businesses and making sure that there's a good match, that we understand what the skills are that businesses need, and then AD Works providing training to meet those needs. That's ongoing, but really developing. Um, our communication department has really gotten a lot stronger. So that's Luke and his team really up the bar, so to speak, in the last couple of years. So there's been a lot of changes, some subtle and uh, some more obvious. But most folks, and I say this, and I'm happy to be proved wrong, really don't know what their county does. We're sort of under the radar. Most folks pay more attention to the city council than they do to the county. And so most of the changes that we've undergone, you might feel or experience, but, uh, you know, it's usually not in the Sentinel or in the newspaper. We're kind of, we're kind of low key.
Well, that's certainly one of our goals in the communications department, is to sort of educate people more about what counties do and don't do. And it's come up a lot in the COVID crisis for people who have had questions about any number of things, from roads to taxes to whatever. So, I mean, also, in addition to what you said, I imagine the population has probably grown steeply in just in the last 5 to 8 years. Is that right?
Yeah, I think it was 500 and something, 510 or something thousand, and now it's over 620, I think. But
Wow.
we'll wait for the census. That'll be really interesting. But yes, you're
Yeah.
right. It has grown. It has grown quite a bit. So lots of developments, lots of projects.
Well, and so with that in mind, are you optimistic about the future of Arapahoe County? We'll close with that.
I am. I think Arapahoe County is really well positioned for the future. We have some incredible people working at the county who are so smart and so dedicated to we always say service first, right? To our residents. And so we will get through this COVID. We will get through this budget crunch. And we continue to win national and state prizes for our various departments. And I foresee that we will continue to do that. We are innovative, we are dedicated, and I think we'll just keep on keeping on.
That's great. Well, thank you so much, Commissioner, and thanks everyone who joined us tonight. As I mentioned at the beginning of the call, we do these quarterly, so you can visit with Commissioner Jackson again sometime in May, and then we will be doing the other four commissioners beginning next week. We have two each of the next 2 weeks, so I would encourage you to join that one, or tell your friends who live in those districts to join in, and keep the questions coming, and we will keep the information flowing. So thank you so much.
Thank you all. Good night and be healthy.